Regarding the exact definition of the nephrotic syndrome, so we have to tell it clearly and what are the components in the nephrotic syndrome that you have to be told sequentially. Basically, it is a kidney condition that results in increased permeability of the protein across the glomerular filtration membrane. And it is characterized by proteinuria, usually in the nephrotic range, which result in hypoalbuminemia. Because of these two, there is a edema and hyperlipidemia. So the nephrotic syndrome is characterized by nephrotic range proteinuria, hypoalbuminemia, edema, and hyperlipidemia. The sequence have to be first and second are most important because it is because of the proteinuria which leads to hypoalbuminemia, and these are the clinical manifestations which results in edema and dyslipidemia. Sometimes these might not be there. The sequence with which you are telling have to be clear because edema doesn't come first the proteinuria. So the proper definition is, it is the kidney condition results in increased permeability of the glomerular barrier to the protein, characterized by proteinuria, hypoalbuminemia, edema, and hyperlipidemia and dyslipidemia, with or without lipiduria. And regarding the nephrotic proteinuria, for adults it is clear it is more than 3.5 gram of protein over 24 hours. The Kidigo have mentioned only this 24-hour uric protein PCR value they didn't mention. And in the PCR also, under the treatment of minimal change disease, they have mentioned as 3.5 gram of proteinuria per gram of creatinine. This is what mentioned. So remember only one value, 3.5 gram per 24 hour. And the hypoalbuminemia, the value is less than 3 gram per deciliter for hypoalbuminemia. If we take children, as per the Kidigo guidelines, to say as nephrotic range proteinuria, the 24-hour urine PCR protein creatinine ratio, if it is more than or equal to 2 gram per gram, or if the dipstick is more than or equal to 3 plus, then it can be considered as nephrotic range proteinuria. So the values to be remembered are for adult 3.5 gram per day, hypoalbuminemia, that is less than 3 gram per deciliter of in the serum albumin. For the children, this indicates the nephrotic range proteinuria. This is nephrotic range proteinuria. This is for hypoalbuminemia as a component of definition of the nephrotic syndrome. So this is the proper definition of nephrotic syndrome.